Hey, it's Scott. And we're here at the ITLS, so the International Trauma Life Support Conference in Houston. And I'm here with Rod and Shifan. And what we wanted to touch on in this week's Gimme Five is a truly unique topic, otherwise known as packing pediatric patients.
So I'm the senior product sales manager. I'm going to step on and do
Woohoo! All right. Thank you for doing this, Ron.
on the True Clot blood that we used. It was developed for the Army to show our combat medics how quick clot works. So you're going to notice that our blood looks like blood, has the viscosity of blood, and clots like blood. So it is simulation, so I don't want anybody to get freaked out.
Okay.
So now, in terms of pediatric, typically most of your commercial windlass tourniquets will work on a pediatric patient. But for those very small pediatric patients, there's two things that we can do. If you find that your windlass tourniquet does not fit around the limbs of the child, then you can either apply direct pressure, which is going to be just as effective, or what they call is a SWAT T tourniquet. SWAT T is a 3-inch rubber band long, and I think Scott had learned how to put that on earlier today. So when we talk about wounding, packing for the pediatric patient is the same as an adult, but obviously the mask is going to look a little bit different. But if I come across a child, and let's just say they have an accidental gunshot wound, first thing I want to do is I want to apply pressure. I want to hold some deliberate pressure whilst I start getting my gauze around. And for this purposes, we're going to use True Clot simulated hemostatic gauze. So you will see that when it comes in contact with the blood, that it will simulate clotting. So now without releasing pressure, I want to start getting gauze into the wound there. And now I own it. I do not want to release pressure because the heart is still pumping. If I release pressure, it's going to be like a garden hose. It's just going to start shooting all over the place. So it's very important that I hold continuous pressure on this vessel here. Now, how much gauze do you think I'm going to put in?
I have no idea.
Well, I'm going to put in so I can't pack anymore. For demonstration purposes, that is what I'm going to do.
All right. So when you're actually doing this kind of packing, whether it's an adult or a peds patient, are you physically, when you put your finger in for the first time, are you feeling for that vessel that you are actually wanting to put pressure against, or are you just putting your finger in the hole?
So it depends. If you're there when the incident occurs and you are trying to stop the bleed, you can try to feel for that because, again, you're going to have the heart hopefully still forcefully pumping. But typically, just in my experience, by the time I would have gotten there, they've lost a lot of blood, so you're not going to have that blood pressure where you're going to feel that. So you want to get to the most prominent point. How do you know where that is? Well, if it's a laceration, you could scoop some of the blood out with a gloved hand and some 4x4s. But with the gunshot wound, you're going to do the best that you can to find that. So now I've packed it. Now, if I'm using a hemostatic agent, I'm going to hold pressure for 3 minutes if I'm a trained professional. If I'm using standard Curlex, you're going to hold for around 10 minutes. Now we'll show you what our product does. And ideally, with the pediatric patient, you would hold your pressure for the allotted time, or professional rescues a rug, and then there's going to be a pressure wrap that's going to be put on there that's going to hold this packing material in place. So you see, we simulate clotting, so you do start to get clots in there.
It slides in my shoes.
And as we get closer to the point of wounding, you'll see that the bandage gets darker because it's soaking up the residual blood in the cavity there.
Mm-hmm.
Now, if I wasn't doing a good job, this would be completely blood-soaked. The blood would still be pouring out. But as you say, we had some pressure on there, and that is what we're looking for there. So we want a nice tenacious clot there to stop that bleeding.
So when it comes to packing pediatric patients, as you touched on, it's exactly the same idea. If you've got direct pressure, absolutely great, use it. If that's not cutting it and you've got some sort of gauze, great, use it. Even better if you've got some fancy gauzes that not only will help stop what's bleeding, but it actually allows it to clot as well. Absolutely use it. So with that, bye y'all from Houston, Texas, and we'll be back with our next Gimme Five really soon.
Scenarios in Seconds was designed to be a simple and effective way to regularly train for pediatric emergencies. A Navy SEAL said it best: under pressure, we don't rise to the occasion, we sink to the level of our training. Ultimately, your next PEDS patient could be your worst PEDS patient, and we don't want you to just get ready, we want you to stay ready. And Scenarios in Seconds was designed to help you do just that.